Hi, I am Dr. Lisa Morgan, and welcome back to Blood Sugar Fix. Today we're talking about something extremely important: 9 warning signs of diabetes that most people completely ignore. And number 6 is something almost nobody connects to blood sugar. But it could be one of the earliest signs your body is giving you. According to the CDC, 1 in 5 people with diabetes do not even know they have it. That is over 8 million Americans walking around right now with high blood sugar, completely unaware. Why? Because the early warning signs are subtle, and they get blamed on stress, aging, or just having a busy life. By the time most people get diagnosed, they have actually had elevated blood sugar for years, sometimes 5 to 7 years before diagnosis. And during that time, silent damage is happening to your nerves, your eyes, your kidneys, and your heart. This video could genuinely save your life or the life of someone you love. So please watch until the end. And if you recognize 3 or more of these signs in yourself, please talk to your doctor and get a simple blood test. It could change everything. Before we start, if you're new here, subscribe to Blood Sugar Fix and hit the bell so you never miss our health tips. Let's get into the 9 warning signs. Number 1, increased thirst and frequent urination. This is one of the most classic signs of diabetes, and it happens for a clear medical reason. When your blood sugar is too high, your kidneys work overtime trying to filter and absorb the excess glucose. When they cannot keep up, the excess sugar is excreted into your urine, pulling fluids from your tissues along with it. This causes you to urinate more frequently, especially at night. And because your body is losing so much fluid, you become extremely thirsty no matter how much water you drink. If you find yourself waking up 2 or 3 times a night to use the bathroom, or you are drinking water constantly but never feel satisfied, this is a major red flag that your blood sugar may be elevated. Number 2, constant fatigue, even after sleeping. This is one that gets blamed on everything except diabetes. People assume they are just tired from work, stress, or not sleeping enough. But diabetes-related fatigue is different. Here is what is happening inside your body. When you have insulin resistance or high blood sugar, your cells cannot properly absorb glucose for energy. So even though there is plenty of sugar in your bloodstream, your cells are essentially starving for fuel. This causes deep, persistent fatigue, even after a full night's sleep. If you are sleeping 7 to 8 hours but still feel exhausted every single day and coffee does not seem to help anymore, this could be your blood sugar telling you something is wrong. Number 3, blurry vision. This symptom scares people the most when they finally understand what is happening, and it should. High blood sugar causes fluid to be pulled from the lenses of your eyes, which changes their shape and ability to focus. Many people notice their vision becomes blurry, especially when reading or looking at screens. The scary part is that this is often temporary in the early stages, meaning if blood sugar is brought under control, vision can improve. But if high blood sugar continues for years, it can cause permanent damage to the blood vessels in your eyes, a condition called diabetic retinopathy, which is actually the leading cause of blindness in working-age adults in America. If your vision has become blurry recently and you have not had an eye exam, please get one as soon as possible. Number 4, slow healing, cuts and wounds. This is a sign that often gets overlooked completely. If you notice that small cuts, scrapes, or bruises are taking much longer to heal than they used to, this is worth paying attention to. High blood sugar damages blood vessels and reduces circulation, especially to your extremities like your feet and hands. Poor circulation means less oxygen and fewer nutrients reach the wound site, dramatically slowing the healing process. High blood sugar also impairs the function of white blood cells, which are essential for fighting infection and healing wounds. This is exactly why diabetic foot problems are so serious. A small cut that would heal in days, for most people, can take weeks or even lead to serious infection in someone with undiagnosed diabetes. Number 5, numbness or tingling in hands and feet. This symptom is called peripheral neuropathy, and it happens when prolonged high blood sugar damages the nerves throughout your body, most commonly starting in your feet and hands. People often describe this as a tingling, burning, or pins and needles sensation. Sometimes it feels like numbness, as if you are wearing an invisible glove or sock. This usually starts subtly, maybe just in your toes, and can gradually spread. The frustrating thing about nerve damage is that once it happens, It is very difficult to reverse. This is why catching diabetes early, before significant nerve damage occurs, is so critical. If you have any unexplained numbness or tingling in your hands or feet, please get your blood sugar checked. Number 6, unexplained weight loss, even without trying. Here's the symptom I told you about, the one almost nobody connects to diabetes. Most people think diabetes causes weight gain, and while that can happen with insulin resistance, the opposite can also be true, especially in undiagnosed type 1 or advanced type 2 diabetes. Here is why. When your cells cannot access glucose for energy because of insulin problems, your body starts breaking down fat and muscle for fuel instead. This can cause significant weight loss, even if you are eating the same amount of food or even eating more than usual. If you have lost weight unexpectedly without changing your diet or exercise routine, this is not something to celebrate. It is actually a serious warning sign that needs immediate medical attention. Number 7, increased hunger even after eating. This might seem to contradict the weight loss symptom, but they are actually connected. When your cells cannot properly use glucose for energy due to insulin resistance, your body sends out hunger signals trying to get more fuel, even though there is plenty of sugar already in your bloodstream. This creates a frustrating cycle where you eat a full meal, feel satisfied for a short time, and then become intensely hungry again within an hour or two. Many people describe this as never feeling truly satisfied no matter how much they eat. If you find yourself constantly hungry, even right after a substantial meal, this could be a sign your body's insulin system is not working properly. Number 8, dark patches of skin. This is a lesser-known sign called acanthosis nigricans, and it is actually one of the more visible warning signs of insulin resistance. It appears as dark, velvety patches of skin, most commonly found on the back of the neck, in the armpits, or in skin folds like the groin area. This happens because high insulin levels in the blood stimulate the rapid growth of skin cells, which contain melanin, causing the skin to darken and thicken. This is considered one of the earliest visible signs of insulin resistance, sometimes appearing years before blood sugar levels become high enough for an official diabetes diagnosis. If you notice unexplained dark patches of skin, especially on your neck or in skin folds, please mention this to your doctor, even if you feel completely fine otherwise. Number 9, frequent infections. If you find yourself getting urinary tract infections, yeast infections, or skin infections more often than usual, high blood sugar could be the underlying cause. Remember, sugar feeds bacteria and yeast. When there is excess sugar in your blood and tissues, it creates an environment where infections thrive. Additionally, as we discussed earlier, high blood sugar weakens your immune system's ability to fight off infections effectively. This combination of more fuel for infections and a weaker immune response is why recurring infections are such a common and telling sign of undiagnosed diabetes. Now, let me give you a quick recap of all 9 warning signs. Number 1, increased thirst and frequent urination. Number 2, constant fatigue, even after sleeping. Number 3, blurry vision. Number 4, slow healing cuts and wounds. Number 5, numbness or tingling in hands and feet. Number 6, unexplained weight loss. Number 7, increased hunger, even after eating. Number 8, dark patches of skin. Number 9, frequent infections. Here's what I want you to do right now. If you recognize 2 or more of these signs in yourself or someone you love, please do not wait. Schedule an appointment with your doctor and ask for a simple blood test called a fasting blood glucose test or an A1C test. These tests are quick, affordable, and can detect diabetes or prediabetes years before serious complications develop. I cannot stress this enough. Early detection is everything when it comes to diabetes. The earlier you catch it, the more options you have and the more damage you can prevent. Many people who catch prediabetes early are able to reverse it completely through diet and lifestyle changes alone. If this video helped you understand your body better, please hit the like button right now. It genuinely helps more people see this potentially life-saving information. Subscribe to Blood Sugar Fix and hit the bell icon so you never miss our weekly health tips. And please, share this video with a family member or friend who might be at risk. You never know, this video could be the reason someone catches their diabetes early. Comment below and let me know. Did any of these signs surprise you? I read every single comment. I am Dr. Lisa Morgan. Thank you so much for watching. Take care of yourself, listen to your body, and I will see you in the next video. This video is for educational purposes only and is not medical advice. If you are experiencing any of these symptoms, please consult your doctor or healthcare provider for proper diagnosis and treatment.